On this Tuesday night, raising the standards of long-term care. After thousands of COVID-19 deaths, new guidelines are out for Canada's care homes.
And it's now time that we just get it done.
Why critics say it's a first step, but not good enough. BC's overdose crisis, who's hardest hit, and the treatments needed. Kids, teenagers, and concussions.
It was kind of scary.
The best remedies for physical recovery and mental health. Plus, two countries sharing a shameful past.
Indigenous people's experience worldwide needs to be known.
Sweden's road to reconciliation with help from an elder in Winnipeg.
Global National with Donna Friesen.
Good evening and thanks for joining us. It was not long ago that we were leading the news with the thousands of people dying in long-term care homes in Canada. As anyone who had loved ones in a care home remembers, the pandemic was devastating, especially in the early stages. Canada's failure to protect the elderly was abysmal. In May of 2020, long-term care residents accounted for 81% of all reported COVID-19 deaths in Canada. That puts us by far the worst compared to other OECD countries, where an average of 38% of all COVID-19 deaths in that period were in long-term care. There were calls for national standards. Well, now they have been created, but they are voluntary. And that means, despite all the promises, they may make no difference at all. Heather Yourex-West has our top story tonight.
It's been 8 years since Amanda O'Reilly's mother suffered a brain injury. Since then, Brenda O'Reilly has been in and out of long-term care.
In the last year, she's been in 2 different facilities. I pulled her out of the first one because I would go in there and constantly find her uncared for.
The crisis that faced Canada's long-term care system during the COVID-19 pandemic laid a series of system-wide failures bare. Across the country, facilities were understaffed, unable to provide vulnerable, aging Canadians with an adequate level of quality care.
The COVID situation, thankfully, is significantly better. It's not gone, but the underlying root cause problems of why Canada did so bad when it came to the pandemic in long-term care still remain.
Long-term care in Canada falls under the purview of provincial and territorial governments. But now new national standards have been released, outlining a minimum level of acceptable care.
2 sets of standards were released: the CSA standards that look at the design and operation of long-term care homes, and then the HSO standards that really speak to what care and working conditions need to be like in our long-term care homes.
Although these standards now exist, not all long-term care facilities will be abiding by them. Only 2/3 of the country's facilities will be accredited based on these standards, and in 2 of the country's largest provinces, BC and Ontario, these benchmarks are only voluntary.
There's nothing stopping us other than political will, and it's now time that we just get it done.
Advocates would like to see the new guidelines become part of not only every facility's accreditation process, but the basis for all subsequent inspections as well.
I walk into that facility and I have strangers who are begging me to help them, and I'm not allowed.
Accountability measures, families like the O'Reillys say, are long overdue. Heather Yourex-West, Global News, Calgary.
When the crisis was fresh in everyone's minds, the federal government promised national standards for long-term care. Today's announcement is the result of that, but because these are voluntary, these guidelines could end up on a shelf unless they're backed by political will. Today, Prime Minister Justin Trudeau said this.
We recognize the responsibility and the jurisdiction of provinces in these areas, but I think all Canadians, regardless of the order of government, want seniors to have the best quality of care possible, and that's what we're going to continue to work on.
With me from Ottawa is our Ottawa Bureau Chief, Mercedes Stephenson. Mercedes, writing down these national standards is a first step. What about legislating them, though, so they're mandatory?
Well, Donna, that's where the devil's really in the details on this. There is going to be legislation called the Safe Long-Term Care Act introduced, and that will happen before the end of 2023, talking about national long-term standards. But these will in no way be enforced by the federal government. It will be up to the provinces and territories whether or not they want to go along with them. Now, that's the opposite, in a way, of what Prime Minister Justin Trudeau said on the campaign trail back in 2021, when he said enforceable national standards standards were what was necessary. We are told as well that when the premiers meet with the Prime Minister in coming days about the Health Care Act and the Health Care Accord that they're hoping to get, these standards are not going to be on the agenda as something that is tied to money. So the provinces are not going to have to agree to these in order to qualify for additional dollars. And that leaves a lot of folks saying, look, everyone can agree that Canadians want this, but when it comes down to it, we still have politicians pointing the finger at each other instead of creating enforceable national standards.
You know, the NDP, Mercedes, said legislating national standards for long-term care was a condition of their agreement to support the Liberal minority government. So what are the NDP saying today?
Well, that's a great question, because this is clearly not going to be enforceable. Jagmeet Singh, the NDP leader, was up asking the federal government if and when they will make this enforceable in question period today. Listen to this.
After seeing the report, the Prime Minister said he was sad and frustrated. But 2 years later, there's been no action. When will the Prime Minister legislate standards in long-term care to protect our seniors? Hear, hear.
And Donna, that's also a question for Mr. Singh and his party. If this is part of their supply and confidence agreement with the government that keeps the Liberals in power, and it is, to have enforceable national standards for long-term care homes, what will they do with the government saying that they don't plan to make these enforceable? Is it something they're willing to bring the government down over? That's unlikely. And unfortunately, that means the elderly may be left paying the price.
So frustrating. Mercedes Stephenson in Ottawa, thank you. Now to the public health crisis over deaths from toxic illicit drugs. Preliminary results from the BC Coroners Service show there were more than 2,200 toxic drug deaths in that province in 2022, the second deadliest year on record. That's just 34 fewer than the 2,306 deaths reported in 2021. It amounts to an average of 189 people dying every month in 2022, and that means about 6 people dying every day. The number of lives lost is hard to comprehend. BC is starting a pilot project that decriminalizes possession of small amounts of certain illicit drugs. It's hoped it will help save lives. Neetu Garcha breaks down the grim facts of BC's drug crisis.
A toxic supply of drugs remains the leading cause of unnatural deaths in BC, significantly more than car crashes, self-harm and homicides combined, according to BC's chief coroner, releasing another tragic set of numbers of fatalities right across the province.
3 of the 5 health authorities experienced their highest rates of death ever in 2022.
More than 11,000 people have died in BC since the declaration of a drug toxicity public health emergency in April of 2016. 70% of those dying are aged 30 to 59, but she says children and youth are being significantly impacted.
Both in experiencing harms from using substances themselves, but also in suffering the loss of siblings, parents, grandparents, and caregivers.
All right, love you.
First Nations continue to be the hardest hit population, with more dying from toxic drugs than from COVID-19, according to the First Nations Health Authority.
Seeking treatment alone in the standard Western format may not meet the needs of all First Nations people.
For all who are at risk, some say treatment options must include a safe supply of drugs.
We currently do not have youth-dedicated overdose prevention sites, as well as supervised injection facilities across this province.
Cities with some of the highest numbers of deaths in 2022 were Vancouver, Surrey, and Greater Victoria, where there's also a high concentration of international students. Some have been sounding the alarm about toxic illicit drug deaths among their peer groups.
So the post-secondary institutions and like private colleges, they are using students as a cash cow, but don't deliver multilingual mental health and harm reduction supports within colleges and universities. I think this should be mandated by the provincial governments.
All this comes as BC decriminalizes small amounts of hard drugs in a move to stem the seemingly unstoppable trend of toxic drug deaths. Neetu Garcha, Global News, Vancouver.
Across this country, there were more than 3,500 opioid toxicity deaths from January to June of last year. BC factored in illicit drugs, but not every province tracks the same data. And when it comes to opioids, the majority of deaths occurred in BC, Ontario, and Alberta. 97% of deaths were accidental. There's a sign Canada's economy is losing momentum. The economy slowed through the end of 2022, though it isn't in recession territory yet. The economy grew just slightly in November at a rate of 0.1%. Early indicators also point to the GDP being flat in December, which suggests the economy grew at an annualized rate of 1.6% in the fourth quarter of last year. Those numbers support what many economists anticipate. A recession is likely sometime in 2023. How severe it might be is up for debate. One thing is already clear: Canadians are struggling financially. As part of our Out of Pocket series, Emily Mertz spoke with an Alberta woman who's on a fixed income and has had to make some hard choices and creative changes.
So 3 years without work has been a real hardship for me.
After nearly 4 decades as a golfer, playing professionally and coaching, Kathy Burton's life changed dramatically.
I am on disability. I've had to sell my car.
Kidney disease, a transplant in 2020, and several infections. Then she lost most of the vision in her right eye. 2 months later, her left.
The interesting thing with golf professionals, most of us don't have a pension.
Burton receives the Canada Pension Plan disability benefit. That gets her just under $1,200 a month. Not enough to cover her mortgage. As she adapts to vision loss, Burton is also finding ways to cut costs.
For an example, I would make a shepherd's pie, but I would add other ingredients to make it more filling. Around the house, I keep the temperature around 15 degrees Celsius. It is overwhelming as I say all those things, but I'm trying my best to kind of try to figure that out.
Across Alberta, social programs and assistance are in high demand. Family and Community Support Services offers things like homelessness prevention, poverty reduction, and aging in place.
We talk about families that are kind of on the cusp, right? That you know they're just barely making ends meet. Well, I mean, these are the times that we're seeing where those people are now being pushed over the edge.
Those on fixed incomes are particularly vulnerable.
The check that you receive, is it enough to pay for rent and to pay for transportation and clothing and food?
That's the question Burton hopes policymakers are asking themselves.
They need to, come and sit in my shoes and then tell me how am I going to pay my bills. Just actually do that.
Emily Mertz, Global News, Edmonton.
To France now, where nationwide protests shut down much of the country again today. It's a backlash to proposals to raise the retirement age from 62 to 64. The French President Emmanuel Macron has tried and failed to do this before. He says French people need to get used to working longer. But as Redmond Shannon reports, he is facing an uphill battle.
Brave defiance for workers' rights or a delusion in the face of an aging demographic? For the second time in 2 weeks, hundreds of thousands of workers hit the streets and picket lines across France, including teachers, train drivers and even ski lift operators. This union leader says government politicians do not know what it means to work in a hospital, a farm or a factory. French President Emmanuel Macron says change is essential if the country is to keep its pension system afloat, as people live longer into retirement. At 62, France is an outlier in Europe. Spain's retirement age is 65, the UK 66. But the British and Germans are moving to 67, and Denmark plans on raising the pension age to 68. In France, those in manual or arduous jobs can retire earlier, with special deals for transit and utility workers too. All could see some increases to their retirement age.
There's of course a general acceptance that something needs to be done, but those who accept that idea don't go on the street. Those who would lose, although they're minority, they go on the street.
The complexity of different labour deals makes a national consensus more difficult. France has a long history of huge strikes forcing the hands of lawmakers, so Macron's minority government faces a tough battle to push reforms through the National Assembly.
I think the chances are very slim because the opposition parties really don't see their own interest in helping him.
Union leaders say 2 more national strikes are planned for early February. Redmond Shannon, Global News, London.
Dozens of funerals were held today in Peshawar, Pakistan, a day after a bombing that killed 100 people, most of them police officers and security personnel. On Monday, a suicide bomber gained entry to a secure area that included the police headquarters and a mosque. Hundreds of people were gathered for afternoon prayers when it happened. Many are still searching for missing loved ones. The Taliban in Pakistan initially claimed responsibility and then revoked it. The group has been behind a resurgence in violence in the region. In Iran, a young couple has been sentenced to 10.5 years in prison for a video they posted of the two of them dancing. This video was taken in front of Tehran's Freedom Tower in November, and it went viral. The woman wasn't wearing a headscarf, which is illegal in Iran, and dancing in public is also forbidden, especially with a man. The couple has been convicted of encouraging corruption and gathering with the intention of disrupting national security. Their families say the couple were prevented from speaking with lawyers and denied bail. A dangerous ice storm gripping parts of the U.S. Coming up, how long the weather system could stick around. After a fairly mild January, winter weather is again causing chaos. This is Metro Vancouver. This bus had a hard time sliding into a number of vehicles as it tried to make it down that street. One of the many fender benders causing grief for drivers. The region isn't alone. Extreme cold warnings have been issued for Northern Alberta right across to Newfoundland and Labrador. Winter storm has created dangerous travel conditions and disrupted thousands of flights in parts of the southern United States. A mix of freezing rain, sleet, and bitter cold has been blamed for multiple accidents. At least one death is linked to the icy conditions in Texas. The storm stretches from Texas to Tennessee, and it's expected to last until at least Thursday morning. Concussions in kids ahead. The new Canadian study suggesting a different way to recover. There's some new thinking about how kids should recover from a concussion. Rest and isolation may not be best. A Canadian study is reinforcing the importance of getting children back into a routine, back to school after suffering a concussion. As Catherine Ward reports, the findings may help develop new guidelines for a faster recovery.
Owen Miller lives and breathes hockey, but just over 2 weeks ago, he suffered a concussion playing the game he loves.
Unfortunately, a player on the opposing team hit him from behind, and he went headfirst into the boards.
I had a bit of a ringing in my ears and a very sharp pain in the top of my head.
This is Owen's first brain injury. Doctors encouraged him to get off screens and to rest.
It was kind of scary because I've heard a lot of bad things about concussions.
But when it comes to just how much rest is needed, new data shows getting back to routine has a positive effect on recovery, especially when it comes to school.
This study now confirms that kids who get back even within 2 days following their concussion to school will help those get back not only school faster, but help them with their symptoms.
A new report looked at more than 1,600 youth between 5 to 18 years of age across 9 pediatric emergency departments in Canada. The data indicates students who only missed 1 to 2 days of school had a lower burden of symptoms 2 weeks later compared to students who stayed out longer. Kids 8 and up with a high number of concussion symptoms benefited the most from getting back into the classroom.
It's important, even if kids are having symptoms, to go back if they can tolerate it, even for just short periods of time, just to be reintegrated as part of the learning process again.
Doctors say it's critical for their mental well-being and recovery.
When kids miss school or they stay in a dark room, don't see their friends, that can lead to fear that they're not going to get better, fear of missing out, and increase their worry. When that worry and that fear exists for longer, it's even harder to break that cycle.
Experts say it's all about balance, so kids like Owen get back to doing what they love.
I do hope to keep playing hockey for as many years as I can.
Catherine Ward, Global News, Toronto.
Truth and reconciliation next. The Manitoba residential school survivor helping guide Sweden. It has been 7 years since the Truth and Reconciliation Commission released its findings, a comprehensive historical record of the residential school system with calls for action. Now, Sweden is launching a similar fact-finding mission, and it's asked a First Nations elder and residential school survivor from Manitoba for advice. Turia Isri reports.
Geraldine Shingus received an unexpected email.
It was the Canadian Embassy that invited me.
The Winnipeg grandmother had never been to Sweden before, but the Canadian Embassy needed her diplomatic help.
This was my first time traveling abroad. I did a lot of research, before I went, because I wanted to know about their history.
Yeah. A history that started with the Sami.
So they're reindeer people?
The indigenous people of Sweden, whose traditional territory spans Scandinavia and Russia.
Their stories need to get out there, not just in Sweden, but worldwide. Our stories are so similar.
Those similarities run deep. Like Indigenous people in Canada, the Sami were uprooted from their lands and sent to church-run schools.
They were not allowed to speak their own language. They were not allowed to use their traditional clothes. And even though they just try to talk to a friend in their own language, they get abused.
For years, the Sami people have pushed the Swedish government to collect evidence and testimony and start a process similar to Canada's Truth and Reconciliation Commission. The Swedish government recently agreed to launch hearings, which are expected to wrap up in 2025.
Shingus testified at the TRC and brought that wisdom to the Sami Commission last October. About her time as a little girl at Muskogee Residential School in Saskatchewan and the beatings that caused her hearing loss.
It's a period in my career that I'll never forget. And I think she did so much to help strengthen the ties between Indigenous peoples.
Shingus thinks Sweden can learn from Canada's mistakes by encouraging more Indigenous participation and leaning on elders.
Indigenous people's experience worldwide needs to be known. That truth needs to come out.
A painful truth once hidden, now spoken aloud. Turia Isri, Global News, Ottawa.
And that is Global National for this Tuesday. I'm Donna Friesen. Tonight's Your Canada is this snowy owl in Regina. Almost can't see it there in the snow. We'd love to see Your Canada. Please email it to us. And thanks for watching. Hope to see you here again tomorrow. Bye-bye.